Thank you so much for joining us. This afternoon we'll be signing 3 bills that I think allows us to continue to be the healthiest state in the nation. As you all know, U.S. News and World Report ranked Hawaii #1 again in the nation in terms of health. And it is measures like the 3 bills we'll be signing today that really puts us front and center, and I think most importantly, allows us to continue to be leading the charge in terms of keeping our community healthy and active, and most importantly, living long and contributing lives. First up would be Senate Bill 549, I think, which is an extension of our Choose Healthy Now, which my wife has been very active on, and she has been an important part of ensuring that our students get off to a healthy start with her Jumpstart Breakfast program, ensuring that our keiki have access to healthy foods in the public school system. Senate Bill 549 requires restaurants to offer healthy beverages as the default choice for children's meals. I think we do know that many bad calories are in the drinks that our children consume, and certainly Senate Bill 549 is an effort to reduce that bad habit that some in our community have. The second bill is Senate Bill 1246, which we believe is strategic importance in being able to develop better health care to all of those in our community. The state has been at the forefront of embracing telehealth and utilizing technology to allow us to be able to reach and deliver services to more in our community. Wanted to thank the legislators here, Senator Baker, Representative Bellotti, who have been at the forefront of helping us develop strong policies. Senate Bill 1246 creates the State Strategic Telehealth Advisory Council to provide advice about how we can increase access to telehealth. It funds telehealth and healthcare access coordinator. It sets up committees to really reduce the paperwork and try and facilitate the transactions of telehealth. And I think it really makes a commitment to making telehealth pervasive and easy for our community, because we know it allows us to deliver healthcare and better healthcare into the far remote parts of our community. And then finally, House Bill 1453, we believe, is a paradigm shift in the state of Hawaii's emergency medical services system. We are focused on how we can make that system more sustainable over the long term, looking at how we can begin to access and assess appropriate fees for the transport of patients to less than emergency rooms across the state. We do believe that this is a mechanism that helps us provide additional resources to those vital first responders who are throughout our community responding to our residents in their time of most critical need. And most importantly, I think it gives us better options for treatment should the treatment include less than medical emergency response. And I think it's a great community partnership. Allows us to establish community paramedicine program that allows us to, again, upgrade our first responders in our counties to be able to allow them to deliver services that they are trained for, and up until this point, not really encouraged to utilize. I'm excited about this measure because it helps us to fund the emergency medical services that our citizens want and need and deserve. And this really allows us to tap into an additional revenue stream. So just really wanted to thank all of you. I know you're all supporters. Thank the legislators here. Representative Bellotti, did you want to make a few words?
Thank you, Governor.
Sure.
So I'm going to speak on House Bill 1453 and just want to give a little bit of background. You know, this bill actually grew out of a couple of things. It grew out of the pilot programs that we know are happening on Hawaii Island, that they were experimenting with community paramedicine. It grew out of a conversation and an informational briefing on the Ohana Zones, Governor, when we had Dr. Danny Chang from Queens talk about how there's a need to be able to transport patients to places other than the emergency rooms where they may not necessarily need that level of care, but things like urgent care clinics. So this bill really grew out of community conversations and best practices, and what we're seeing on the national level is that Medicare is now pushing towards what's called ET3, Emergency Treat and Transport, and we're really actually positioning the state of Hawaii to be at the forefront to be able to take advantage of national programs. So when you see headlines that say Hawaii has the strongest health laws because of strong state laws, it's because we are ready, even before the federal government is ready, to begin to do things. And it's really a tribute to the people who are here. So thank you. Thank you to the stakeholders, and especially the Department of Health, who is very helpful. And thank you to my fellow colleagues who really helped make this bill happen.
Thank you. Thank you.
Thank you, Governor. Thank you for signing these bills. Thank you to the Department of Health for all of your collaboration, and Speedy Bailey and the folks with our EMS services, as well as my colleagues on the House side. I've been a partner with Representative Bellotti on a lot of health issues, and some of them are carrying forward. You know, two of these bills are really about access to care. And that's been a theme, I think, throughout the legislative session this year and last year. Because if we have health care but people can't access it, what good is it? And we really see that because we have so many rural areas in our communities, that we need the ability to do telehealth. We need the ability to have community paramedicine out in the communities and addressing folks that may not be able to access it. And I have to relate a story. I had some folks who were from the med school coming in and wanting to lobby me on some of these bills, and I'm going, I'm way ahead of you. We're already there. But I think it's a recognition among all of the folks that are going to become doctors and APRNs and others that you need to have this reach, and to be able to utilize telehealth in such a robust way is really exciting. And I must give a shout out to Hi-Fi for all of their work on Healthy by Default. You know, this is really something that's going to help children's teeth. It's going to help their physical abilities, and it's really going to make a difference, I think, if we teach our young people not to go for the sugary, sweetened beverage, but to go for something that's water or milk or something that's more healthy. So a shout out to all of these folks who have been advocates, and a shout out to you, Governor, for addressing them in some of the bills that your administration introduced, as well as supporting the other ones that we have before you. So thank you so much.
Thank you.
He signed a lot today.
Okay, first up is Senate Bill 549, Senate Draft 1, House Draft 2, a bill for an act relating to healthy beverages for children. This sets as the default option the healthy selection. And it now is law of the land as Act 138. Next is Senate Bill 1246, Senate Draft 2, House Draft 2, Conference Draft 1, a bill for an act relating to telehealth. And this is an effort to make telehealth mainstream and accessible to all of Hawaii citizens. And it's now law as Act 139. And then finally, House Bill 1453, House Draft 1, Senate Draft 1, Conference Draft 2, a bill for an act relating to emergency medical services. This is to establish and expand the community paramedicine program and looking for ways that we can have other options than emergency room care. Now law as Act 140. Congratulations.